Welcome to Beyond Hormones, the Business of Wellness, the podcast for hormone and functional medicine providers who want a thriving, predictably profitable practice and maybe a little less stress along the way. Hi, I'm your host, Jody Lane, and I've worked with lots of clinics in marketing, sales, and business development, and I have seen what works and what doesn't. And here's what I believe. Hormone and wellness care should be available to everyone who wants it. And while providers know the medicine, many struggle with the business side of their cash practice. And that's where I come in. See, this podcast is here to share real strategies, real stories, things you can implement in your practice right away. So I am so glad you're here. Come on, let's go. Hey friends, it's Jody here with Accelerated Medical Practices, and welcome back to Beyond Hormones, the Business of Wellness. Today's episode is such a good one. I am speaking with my friend, Dr. Steve Gershon from Optimized Hormones in Virginia Beach. What I love about his story is how he started in pain management, grew a huge practice, and then realized there was something missing. So he didn't stop. He built a hormone clinic focused on truly helping patients heal from the inside out. We talk about everything in this podcast, from switching to cash pay and fixing early pricing mistakes to building a culture where listening is the most important skill in medicine. It's honest and it's inspiring. And it's a reminder that when you put patients first, everything else just falls into place. All right, let's get into it. Hi, Dr. Gershon. I am so excited to have you on this podcast. How are you?
Awesome. Thank you so much for having me. Really appreciate it.
Definitely. Now, full disclosure, we've been working together for several years. We met, I think,
Yes.
3 years ago.
Yeah, that sounds right. Either 3 or 4 years ago. I don't
Yeah.
remember the exact date, but I really remember the context in which we met, and I was just so excited about it because of the fact that I think I mentioned this to you when we first met, that I was literally reading the book Traction with one of my employees on the plane on the way over there. And then when you started your presentation, it was clear to me that you knew Traction really, really well. So I couldn't wait to sit and talk to you after your presentation. So it was awesome.
So, for a little context, for anyone who doesn't know what that means, so we were at a WorldLink Medical Business Conference, and I was teaching about marketing and culture.
Right,
And Traction is a book by Gino Wickman, who created
right,
EOS worldwide. You are an
correct,
EO guy. You're involved with EO, and
right,
yeah, I live my life based off of Traction, not just my business, but my life, because it all works
right,
from those
right.
concepts. So if you're listening to this and you haven't read that book, go read it. And if Gino Wickman's listening, I'm a big fan. I actually have a friend
Yeah,
who knows him, and I've been trying to get him to introduce us. But anyway, I digress. Tell us a little bit about you. What is the name of your practice? Where are you located? And when did you start it?
sure. So I have two different practices. So my
Mhm.
first practice has to do with pain management. So I'm a physiatrist by training, a physical medicine and rehabilitation physician. So I did my training at NYU in New York City, completed that, came to practice in the Commonwealth, the state of Virginia. And myself, one other person, started a practice, in 1992. We started growing that practice in a very big way, and I became the managing partner of that practice. So that took me 1 day a week out of clinical responsibilities and doing all administrative responsibilities. We ended up growing that pain practice, a total of 10 providers. We had 4 locations in 4 different cities in the coastal Virginia region. So it includes areas such as Virginia Beach and Norfolk and Chesapeake, and then another area on the other side of the water called the Peninsula, where Hampton, Williamsburg, and so we had locations in a number of different areas. And then in around, gosh, probably 2006, I broke away, started my own practice, and started building that practice up on the pain side. So I've been doing that for quite a while. And then in 2014, 2015, I started taking courses on bioidentical hormone replacement therapy. I just felt there was something missing in my physiatry practice that really the physiatry world didn't address. And in doing so, created a company initially called Gershon Preventative Medicine. We rebranded, as you're well aware, to Optimized Hormones. So that's a little bit about me and my two different worlds and two different hats that I wear.
But you're kind of a unique physician in the respect that when most people hear the term pain management, they first think drugs, right? You're giving pain medication, but you don't
Yeah.
do any of that at your practice, right?
Correct. Yeah. So our vision and philosophy is very, very different in that practice. So we're more concerned with really figuring out what the source of the patient's pain is, getting down to really the root level of it, as opposed to giving them medications that might diminish some of their symptoms or their perceptions of their pain. We're less interested in that and much more interested in trying to figure out the true source of their pain, addressing the source of their pain, getting them as functional as possible, trying to eliminate if they're already on opioids, get them off of opioids, and work side by side with a number of different members of our community, especially physical therapists and other like-minded individuals, whether it be nutritionists or dietitians. Sometimes we employ pain management psychologists and therapists along with what we do. So it's really an interdisciplinary approach to the practice of pain management. We also do quite a bit of interventional spine and sports and outpatient musculoskeletal medicine. So that's a little bit about that portion of our practice.
Yeah, well, I wanted you to talk about that because, some people may think, well, how did you get from pain management to hormones? But in reality, in the pain management side, you were doing what a functional medicine doctor really strives to do, which is, like you said, look at the source, try to figure out the source of the problem, really get and attack that. So how come so you started Gershon Preventative in what year? Do you recall?
Gershon Preventative was 2015.
Okay, 2015. So, but it took quite a while for you to kind of get it off the ground. What do you think some of the stumbling blocks were?
Well, there were many of them. So in the beginning, you have to sort of figure out which way you're going to go. Are you going to go the insurance route or not the insurance route? So that's the first fork in the road, is making that decision. And for someone who's always been in the insurance side of things on the pain management side, and there are pain management physicians who do practice more of a concierge type of medicine. That wasn't us and isn't us. And then I had to make the conscious decision, which way am I going to go? So if I'm going to go down the route of insurance for that, there are some issues with respect to malpractice, because
Mhm.
some of the malpractice carriers really want you to be board certified in, for instance, OBGYN or internal medicine, to go down that particular pathway. And then you have to play by all the rules of the insurance companies, which oftentimes go against what we're taught in these courses. So if you're practicing true BHRT, bioidentical hormone replacement therapy, meaning all non-synthetic type of approaches, things that are naturally occurring in nature or naturally made from plant type products. So that was the first decision point, and I went along the decision point of I was going to go on a cash pay basis. So in doing so, you are foregoing a huge percentage of the patients of your current practice, or if you were just hanging a shingle outside, it's much easier if you were going to accept insurance. There are lots and lots of issues of not accepting insurance. We had to make that decision. It was a difficult decision to make in the beginning, and it took us probably a year to make the final decision which way we were going to go. Ultimately, we decided the cash pay basis was what we were going to embark on. So there were a lot of stumbling blocks with that in the beginning. There were legal stumbling blocks. We had to ensure that we set up a company that was outside the parameters of my current company, so
Right.
that I was able to still accept insurance on one side of the house, but not on the other side of the house. So that had to be separate tax ID numbers, separate structures to the corporation. So that's sort of the decision that we ended up making.
Gotcha. And that's when I got into this industry too, 2015. And it was a very different environment as it is now,
Very
10
much
years
so.
later, in
Yeah,
terms
yeah.
of what people were willing to spend their money on. Yeah.
Yes,
So
totally
for
agree.
somebody that is like somebody who has a practice right now and is thinking about starting a hormone clinic,
Yep.
despite the administrative and the legal issues, what would you say they should do? Should they try to bring hormones into their existing practice if they can, or do you think that having two separate practices makes better sense?
I think, especially in the current environment in which we live, two separate practices make much more sense. So, again, when you're dealing with insurance companies, you have to pay attention to the insurance company's rules. And the insurance company's rules may be that they don't want you prescribing estradiol. They might want you prescribing a synthetic type of hormones. So, for instance, Premarin, which means pregnant
Mhm.
horses, pregnant mares. So, pregnant horses, of course, have, when they're making the Premarin pill, it's formulated by getting the urine of pregnant horses. And when they're doing so, there are 20 foreign estrogens to humans in there. So, there are all these different issues that are associated with those types of hormones, but you're going to feel pressure from insurance companies to prescribe that and prescribe something called medroxyprogesterone, which also has its whole long list of issues associated with it. And they're serious issues. These are things like heart disease and
Mhm.
cancer and blood clots, etc. So there are lots and lots of reasons of why not to go down that path, which is why most people who are entering the BHRT world are going into it to begin with, because they want to express to patients that there are different types of alternatives that are out there outside of putting foreign substances in your body. Why not put back in what your body naturally
Right.
produced? Yeah,
Right. All right. So that's a really great answer. So let's fast forward a little bit. So
sure.
2015 is when you started, but it took a few years to get it off the ground. We met, I believe it was 2021. Then that's when you brought Kate in. So you had your first employee that was separate from
Right.
Gershon Payne. So
Yes,
in
yes.
that time frame, what would you say was one of your early wins? Something that you did that really you went, wow, I'm glad I did this because now I'm taking this company to the next level.
So one thing we started doing was focusing on the patients within our current practice as opposed to
Mm.
patients outside of our practice. So we started having discussions with patients in the room. So they're coming in for pain, and it may be that they weren't responding from a pain perspective, from a healing perspective as quickly as possible. So one of the big wins was taking a look at these hormone levels. So in women, estradiol and progesterone, in men and women, testosterone levels, different thyroid levels, different vitamin levels. Vitamin D was an important one. So taking a look at those levels and seeing if patients were missing something internally that would help in terms of healing some of their pain issues. So that was a huge win for us. So it was a combination of having discussions with existing patients of our practice, and then getting blood work on those patients who weren't healing in the way that we thought that they should heal.
I would imagine sleep would be a big part of that too, right?
Yeah, so sleep, stress, anxiety, mental stress as well. So all of these different components definitely played a significant role in trying to figure out where the source of people's problems were coming from. So, as you point out, like sleep-wake cycle dysfunctions can exacerbate healing. It can exacerbate problems with hormones. It can exacerbate the way in which we metabolize glucose in our body. So stress as well as sleep play really critical roles in all these different physiologic functions.
Okay. So that was a win. Now, you probably made a couple of mistakes, right?
Oh, yeah,
Along the
plenty.
way.
Yeah, yeah, yeah.
Can you share maybe one or two and what you learned from it?
Yeah, absolutely. So what we didn't do well in the beginning was pricing, which is really where you helped us tremendously. So in the beginning, we had pricing all over the place, and we had different prices for different people, which really didn't make a lot of sense. As you pointed out to me, we had different prices for men, different prices for women, different prices for patients who purchase supplements, patients who didn't purchase supplements from us. Were they going to get the hormones directly from us? Were they going to be sent to a pharmacy? So you helped us, and it was really integral in terms of just coming up with a very, very simple payment plan for patients and different programs. So, for instance, we have a PCOS program, we have a BHRT program, so we have a weight loss or a weight management type of program. We had probably 30 different types of programs before, and now we condensed it to 2 to 3.
Yeah. Okay, great.
So that was a
Yeah, and then
huge
so many
mistake we
people,
made.
most people don't even realize that besides just the simplicity of it, sometimes pricing is just thought up out of the air and no one's really looking at where the expenses are coming from, where the costs are coming from. That's one of the things that we try to instill into providers because they're not, you guys aren't taught that stuff, right? Like you don't know that. You're luckier because
Right.
you had background as an entrepreneur, but most don't.
Yeah, no, you're exactly right. So when I first came out of training, I had literally zero training in how to run a business and how to keep expenses, what's the difference between a P&L and a balance sheet, and what are things that we could do that would help improve revenue and offset increasing costs of wages and increasing costs of medical supplies, that sort of thing. There are very few courses that are being taught in this vein. So there's a class so I'm also an assistant clinical professor at our local medical school. And so I teach the medical students. I happen to have a medical student who's listening in on our conversation right now, as well as teach the residents and the fellows in physical medicine and rehab. So in doing so, we created a course called the business side of medicine. So on a once a month basis, we go out and we have different speakers that are coming in. I may actually invite you to become a speaker on this, so
Love
that would
that.
be wonderful. Yep. So yeah, it's a really neat thing to be able to pass that sort of information off. But as you point out, in the beginning, no one teaches this to you. There
Yeah.
aren't courses in terms of how to bill, how to run a practice, how to set up the proper corporate structure for your business. There's S corporations, C corporations, LLC, so PLLC. So there are all these different things that are really important for practitioners when they first come out.
You bring up a good point. There's a lot to know, a lot that maybe you don't know. Maybe the people don't have access to those kinds of courses or education. So when someone's starting out and when you started out, like you don't have the money to bring in a bunch of staff. You can't bring in a bookkeeper and a tax accountant and a salesperson, all that stuff. So how do you build like a founding team for a clinic so that you get all your areas covered?
Yeah, so we were fortunate in the sense that we already had a very efficient clinic on the pain side. So that had a lot of ancillary extra income sitting on the sidelines. So I never really had to take out any loans, literally for anything. So when I started my pain practice, I literally didn't take out any loans, which was wonderful. And throughout the entire process with Gershon Preventative Medicine, now Optimized Hormones, I never had to take a loan out there either. So in the beginning, unless you have this other side income source, you're going to have to take loans out. And there are different ways in which people can take loans out. That's a whole separate conversation, looking at small business loans and looking at loans that if you are opening a practice in an area that there may be tax credits that you can get from the cities, that sort of thing.
Hmm.
That's always helpful. So having that background and understanding of what's potentially out there is incredibly helpful, but you really need a team. So you need an advisor really to help start a practice. So like your company is really good at coming up with business plans. Once you have a business plan, you can then present that business plan to your bank, and then you'll be able to take a loan out from your bank. Without that business plan, no one's getting loans. So
Yeah.
especially nowadays with all the different regulations that the government is requiring to obtain loans, you have to have very, very specific obtainable revenue coming in order for a bank to put a loan out to you.
Yeah, and I'm going to endorse what you just said because I've worked with a lot of practitioners that have other jobs, maybe not other clinics or other practices, but other jobs. And they don't want to take the loan out and they want to just build over here into their new practice to
Yeah,
replace their income where they have. And it's really hard because
it really
you
is.
don't need to just replace your physical income that pays your bills at home. You need money to market. You need money to hire staff. You need money to get tools and softwares and an office and all that stuff. And I have not seen, well, that's not true. I saw one practitioner actually succeed at that. Dr. Hoff and his wife Tina, who's also in Virginia, not Virginia Beach, but they're north of you. They did it pretty
Right.
successfully. Let's bring us back to today. So
Sure.
you decided to rebrand,
Yep.
and I'm just curious, like, what was that process like? Why did you choose to rebrand? And what do you think you could have done differently so that you didn't have to rebrand? Because I'm sure it was a little bit painful.
Yeah, it was definitely painful to rebrand. So the name of my pain practice is Gershon Pain Specialist. So there was this natural tendency to use the name because we have a reputation in our community as a leader in the pain field. So we thought we could leverage that name recognition and utilize that for Gershon Preventative Medicine and have more of a preventative medicine type of clinic. And though it worked well, no one really understood what it meant. And so it was a poor choice of a name. Yes, we capitalized on the name recognition, but by the same token, it was not really a descriptive term. So the first thing is you need to work with a team, and that team should consist of someone who can help you in terms of the branding, in terms of the marketing, in terms of the finances, in terms of creating a business plan. It really takes a village. It's rarely one individual who can do all that. So in our practice, what we did, as you're aware, is we worked with yourself as well as Jamie. Both of you were incredibly instrumental in helping formulate where we are today. And we worked with Molly, who has her own different areas of expertise outside of mine, outside of yours and Jamie's. And so together, sort of the three of us really created the concepts of, okay, let's simplify the name. Let's make sure that there's recognition within the brand name Optimized Hormones of what we do. So Optimized Hormones essentially tells us what we do. Now, the downside, though, to doing that is, as maybe we'll speak about later, we're going to be launching a longevity program. So then the question, of course, is, do you go through an entire name change again, which I don't really want to do, or do we brand it separately as like Optimized Hormones and Longevity or something to that nature? So I would tell people who are first starting out, really give a lot of thought and effort into the branding, the marketing. Think about what your vision is, think about what your core values are, think about what your core focus is, what your niche is going to be, what your marketing strategy is going to be, and have that all as a seamless plan.
Absolutely. Yeah, no, I'm so glad you shared all that because that's why, I mean, I knew kind of a little bit about that story, but I wanted you to share for the listeners because a lot of times we do just sort of like either think anecdotally what we want to call our business, or now we go to ChatGPT, we rely on them or her, mine's a girl, I named her Jenny. We rely on her to tell you what it should be. But it really is about thinking through what your long-term vision
Yeah,
is and where you
yeah,
want to go so that you can encompass all of that because we can't do everything on day one.
exactly, exactly. It's a
Hey,
process. It takes a long period of time.
yeah. Yeah,
Yeah,
definitely. Yeah. Your practice is amazing. I mean, if I
thank
was
you.
in Virginia Beach, I would be sending every person I knew there. So, what do you think the unique value proposition about your clinic is?
I just have to distinguish between the two. So on the pain side, again, it's sort of getting to the source of the patient's pain, trying to really figure out what is causing their problem and take a holistic perspective in whatever that particular problem is. So if someone comes in with back pain, well, it's not just looking at their back, it's looking at the way they walk, looking at their shoes, looking at if they have a leg length discrepancy, it's your family history, different tendencies. It's the same sort of thing on the hormone side. So it's taking a very holistic perspective of what the patient's symptoms are, coupling that with what their labs are showing, coupling that with their physical examination, and then taking into account all these other disparate factors, such as their stress, their emotional stability, what their family histories and tendencies are, and then putting that all together into a plan which is individualized for each patient.
And how do you ensure that that happens? I mean, you're one person, you have many providers underneath you on both sides. So, how do you ensure that
Well,
happens?
so it's a training issue, really. So on the pain side, we have a formalized program where we train APPs and we train them to do different types of physical exams. So they have to be experts in shoulder exams and knee exams and hip exams and back exams and exams for patients who have headaches or fibromyalgia or neck pain. So they have to understand the basis of the questions that they're asking, the history component, and then the physical exam component. It's a little easier, but somewhat difficult on the optimized hormone side. So there, the exams are more basic and more in tune to more primary care physician exams. So it's listening to their heart and listening to their lungs and seeing if they have any peripheral edema, feeling their thyroid, seeing if they have any evidence of lymph nodes, that sort of thing. So the physical exam is a little easier to do, but then there's the difficulties of if the patient kind of throws you a curveball. So you have to have a good understanding of internal medicine. You have to have a really good understanding of endocrinology. So it takes a really, really long time to get good at being proficient in prescribing hormone replacement therapy for men and for women.
Absolutely. And let's talk a little bit about culture because we both agree, we love traction, we love that whole concept. What is your definition of culture and how do you work to make sure that culture exists in both your practices?
So I think the culture from our perspective is ensuring that patients feel heard. So being listened to is really, really important. And it's a it's a skill. It's not something that comes naturally really to anyone. And you have to practice over and over and really get into the patient's head and understand what they're feeling, why they're feeling that way, how they came to be in the position that they're in. And there's a lot of tongue biting on my part, especially in the beginning of I've got to let that patient talk. There was an interesting survey that came out a couple of years ago in JAMA, and basically what it stated was that patients get interrupted somewhere between 18 and 30 seconds from the onset of a conversation with their physician. And so
Oh my
now
gosh.
it's terrible. It's terrible. And finally, it's being taught in medical school that you don't say a word to the patient until 2 to 3 minutes into the conversation. It's just a lot of eye-to-eye contact and
Mm,
shaking your head and just making sure that you're really being a good listener. So I think the culture of listening is really important to us. I think validation is another important part. So validating what a patient is saying to them. Mrs. Smith, I could totally understand why you're feeling so fatigued all the time. And I understand that you feel as if your body has changed over the last couple of years. And despite you exercising twice a day and eating really clean, you're having these episodes of feeling brain fog and fatigue, and you feel as if your life is getting away from you. So it's just validating
yeah.
everything that the patient is saying. So instill that sort of culture, both sides of our house, on the pain side, and especially important on the hormone replacement therapy side. So one trick that I've really tried to incorporate is making sure that my APPs, my physician assistants, my nurse practitioners, are in with me on their very first day of training and spending the entire day with me. And it's trying to get them to understand why I'm doing what I'm doing, being really patient with the patients and trying to get them to understand what our final goals are here, because we all have the same goals, right? We want to
Right.
improve the lives of our patients, but there are ways in which there's no shortcuts in terms of doing that, and trying to get them to understand that from day one is very, very important to me. So trying to get the practitioners to listen to patients and to validate patients, I would say, just non-starters for me if I have an APP who's not, following those sorts of cues.
They're out. Yeah. That's so cool. I wish that everybody thought that way. Imagine if we all just listened to each other. I mean,
Yes.
outside of just the medical space, like
Right, of
it would
course.
be incredible. So you mentioned that most healthcare providers are in it to help others.
Yes.
So, and I know that you do. And let's talk about the hormone side for a second. Can you
Sure.
tell us a story without using names of
Right.
somebody's life that you changed that kind of you carry that around in your heart?
Oh, yeah, sure. So the one that stands out, which is really, really recent, is a friend of mine had called me up and said, my daughter is getting married in a couple of months, but she's gaining all this weight and she doesn't feel like herself and she doesn't feel well. And she went to her primary care doctor, and the primary care doctor kind of blew her off. And she ended up seeing an endocrinologist, and she just didn't think that there was anything wrong with her. And then I had seen her maybe probably 6 weeks after that. So, in defense of these two physicians that did see her before, I'm sure the numbers I'm about to tell you would have changed dramatically since the point they saw her when I saw her. But what we're taught, as I'm sure you're aware, is the fact that normal isn't optimal. And there's a huge, huge variation in terms of numbers. And the one I like to give to patients is the example of vitamin D.
Hmm.
Most labs, the lower levels of vitamin D are 32 and the upper levels are 100. And that's a huge variation, 32 to 100 being normal. And so if you think of someone who may have a vitamin D of 33 or 34, well, they may go to their primary care physician and say, hey, you have a
You're
normal
fine.
level. But the patient may be symptomatic. So they may have, and this was a great case of this, of decreased energy, and her overall sense of well-being was really low. And she recently had an injury. She had run a marathon and she had an injury in the marathon and wasn't healing properly. And so it turned out that when we saw her, she had relatively low vitamin D, so the number was about 33. And then, more importantly, her TSH was elevated. So we started looking at not just TSH and free T4, which is the number she had before, which they were both in the normal range, but they weren't really in the optimal range. But no one had evaluated her free T3. And her free T3, of course, is the active form of thyroid. So As I'm sure many of your listeners know, that there are four iodine molecules around a T4 molecule, and you have to have an enzyme called 5' deiodinase, which will then strip away one of those iodines to make it into T3. So T3 has three iodine molecules around it. And that's the active form of the thyroid hormone, T4, which is what most practitioners give as hormone replacement therapy for people with thyroid disease. They're banking on the fact that they have the proper amounts of that enzyme 5' deiodinase. And if they do have it, well, then they can convert T4 into T3, but not all T4 gets converted into T3. And so depending upon if we have some resistance in that hormone, just like we can have resistance in hormones of diabetes, we hear of this insulin resistance. Well, you can also have different types of resistance in thyroid hormones or any hormone in the body. It's not just that one. It turned out that her T3 was essentially non-existent in her body. Her T3 was below 1, and below zero point 0.2 is essentially incompatible with life at that point. So this is a woman who came in 6 months before her wedding, and she had gained about 60 pounds after this marathon. And everyone said, well, you had this ankle injury and you weren't able to work out as much. Well, it turns out that wasn't the case. It was the fact that her T3 was essentially non-existent in her body, and so we just simply replaced it. She had a really, really elevated TSH. By the time I had seen her, it was in the 60s, which is unbelievably high. So it was an episode of basically Hashimoto's disease that probably was caused by stress of the marathon and her upcoming wedding. So she developed this autoimmune disease. We simply replaced it. And within 2 months, she lost 40 plus pounds. It was mainly, of course, it wasn't body fat. It was a lot of fluid that she was holding on to. And on her wedding day, she was her ideal body weight and she was just thrilled. So it's
And
just, that's
especially
really
energy, like unbridled energy, right?
different world. Yeah,
Yeah.
different world. Yep.
Wow. That's so cool. I love this one. I ask everybody this question because I just think
Yeah.
that, you know, building a business is hard. And, all the struggles you go through administratively and with money and with staff and all of that. But when it comes down to it, when you hear stories like that, it just makes it all worth it.
Absolutely. Yeah.
So, two last questions. Do you have a mentor?
Sure. Yes.
Who's your mentor?
So I have three, actually. I have three
Okay.
mentors. So the first one was Neil Rousier, who you know Neil. So that's an entire story. I'll try to make it as brief as possible.
That's all right. Go ahead.
Yeah, I'm a real believer in things happen for a reason. And I had a paper that showed up on my desk one day, and it was about a course called Neural Prolotherapy. Now, in our pain side of our house, we do something called neural therapy, which is injections into like scars. And then we do this thing called prolotherapy, which is injection into ligaments to help tighten them up. So I'm like, oh, this is awesome. I'm going to get a refresher on neural therapy and prolotherapy all in one course. This is amazing. Well, it turns out that that was not the case. So I go to the course, and it was this guy by the name of John Liftoff who was teaching this class on something called neural prolotherapy. And I was listening to his lecture for the first 2 or 3 hours, and he was talking about, and I'm an anatomy, I love anatomy. And he was talking about anatomy I've never even heard of before. And there's a woman who I sit next to every course that I go to, she is at. And we're both course junkies and we're looking at each other. And I said to her, so when is he going to talk about the neural and the prolo? And she's like, you've never been to one of his classes before? I'm like, no. She said, I can't believe you haven't been to this. She said, it is completely going to change the way you practice medicine. And it turns out that he uses a concentrated solution of dextrose to block nerves. And so she said, yeah, it's going to totally change the way you practice. And it was really true. And so then I went to another course of his where he was a speaker for, I think it was a random conference that does some more holistic and more regenerative medicine type of things. And in there was Neil Rousier giving a lecture. And I'm listening to it and I'm hearing all these people, just like chattering in the background. I'm like, well, what is going on? And then I went up to Neil at the end. I said, that was an unbelievable lecture. I had no idea about bioidentical hormone replacement and why it's really important in my field. And maybe I should consider taking one of your other courses. Do you teach other courses? And of course, he told me about WorldLink, and that completely changed my life. So it took me literally several thousand hours to feel comfortable. So I did his courses over 2 years, every course twice. So he had course one, two, three, and four. And so I took them twice. They were only offered back then once a year. So it took me 2 years to go through it. And every night I would spend 2 or 3 hours writing out everything that he said and reading it over and making adjustments to it. And so he's clearly mentor number one. Mentor two is Peter Attia. So
Mm.
Peter Attia has a podcast, The Drive, and I spend at least 2 or 3 hours a day listening to his podcast. His podcasts are brilliant. I would encourage all of your listeners to subscribe to his podcast. He has a free podcast, which gives maybe 30 to 50% of the information. You really need 100% of the information. He does an incredible job on deep dives on things like hormone replacement therapy. He speaks a lot about the difference between lifespan and health span and taking a look at how we go about treating patients who have dyslipidemia, differences in terms of helping reduce cancer rates and looking at different types of neurodegenerative diseases like Parkinson's disease and Alzheimer's disease. So his book is amazing. His book is Outlive, and then his podcasts are absolutely brilliant. I think every single practitioner should have, two mentors like Neil and Peter Attia. I've never met Peter Attia. I've never attended any of his conferences, but I listen literally every single night to at least one of his podcasts. So those are two mentors that I have from the perspective of this world. And then the other mentor has more to do with the entrepreneurial world. So that's divided into two different people. You are one of them.
Oh my goodness
And
gracious. Are you serious?
it's true. It's true.
Oh,
And then on the other side is my group, EO, the entrepreneurial organization. So for those people who aren't familiar with EO, it's an incredible organization that helps people who are entrepreneurs just starting a business. You do have to have a certain amount of revenue to get into what's called the accelerator component. Once you have that revenue, which is 250,000 in revenue, it's not like you're taking that home, but you're bringing in revenue of 250. And then the accelerator component is their goal is to get you to $1 million in revenue within 1 to 2 years. And they're successful probably 80, 90% of the time in helping put specific standard operating procedures in place and teaching you how to deal with numbers and people and balance, understanding the difference between a P&L and a balance sheet, and just understanding business in general. So that's been really integral in helping me to where I am today.
that's fantastic. Definitely, if you're listening to this, go see if there is a chapter in your town because there's not one in Orlando, which surprises me so
Shocking. That is
much.
shocking. Yeah,
But I hear you talk about it all the time, and it really does sound, life transforming. So
it is.
awesome. All right, so we do one last thing.
Sure.
I stole this, so I can't take credit for it, from Steve
Okay.
Bartlett, who has a podcast called The Diary of a CEO. If you haven't listened to it, I highly recommend. He is an amazing interviewer. And he asks a question to the current guest that came from the last guest, but you don't know who that is, and they don't know who you
Ah,
are. Okay.
awesome. Yep.
So your question is, how aligned is your business with your core values or your first principles?
That's a really, really good question. Our first core value so we're really, really aligned and we spend a lot of time discussing our core values. But I think the one for me that it rings true and it's how I live and breathe and function in my office every day on both sides of the house is called patient's needs first. So before any decision is made in the practice, it gets filtered through that particular lens of, are we doing what's right and best for our patients before we're doing anything right for ourselves, before we're doing anything right for the employees of the practice? It's all about the focus on patients. And I've always been a big believer in, if you live life right and if you practice medicine correctly, which is always patients' needs first, then everything else will fall into place after that. The money will come, your recognition will come, all that stuff, of course, is secondary. You never do that to start a business and you never do that to start a medical practice. But if you do what's right by your patients, everything will flow. So your patients will refer patients to you and your patients' will refer patients to you. But you're always doing everything for your patients before you're doing anything else in life.
Amen. And this is why I adore you so much.
Thank
You'd
you,
be
Jody.
surprised, you say that if you're a medical practitioner, then you believe this. That is not always true. I mean, you and I have both met people that don't operate from patient needs first. And what, like you said, everything else will come. Well, if you don't operate that way, oftentimes the business is not successful. And I've seen it
It's
happen.
true.
So, yeah, so that's really, really amazing. Thank you for sharing and being
Yeah,
vulnerable and sharing all of the good and the bad and the ugly and helping whoever is
absolutely.
listening to,
Yeah,
learn from your mistakes and to celebrate your glories with you. Really appreciate it.
absolutely.
All right. Well, if
Thank you so
anyone's
much,
ever
Margaret. Thank you so much for having me.
Oh, absolutely. Absolutely. I really appreciate it. And if anyone's in Virginia Beach and wants to come see you, you got Gershon Pain Specialist at the one side of the house and Optimized Hormones on the other.
Thank you, Jody.
All right. Thank you.
Okay, bye.
Bye. Thank you for listening to Beyond Hormones, the business of wellness. I hope that you're walking away with fresh ideas and real strategies you can use to grow your practice with profit and purpose. If you enjoyed today's episode, be sure to follow the show so you never miss a conversation. And if something you heard today resonated with you, do me a favor, share this episode with a friend or a colleague. It's one of the best ways you can support the show, and it might be exactly what they need to hear right now. If you want even more tools and support, go ahead and head over to acceleratedmedicalpractices.com. Until next time, keep doing the work that matters. Your patients need you, and I am cheering you along every step of the way.